Hello and welcome to The Print. I am Sumi Sukanya Dutta and you are watching Health in You. COVID, after a long time, is back in news. The cases are rising, as are some deaths. And this, in some people, has really caused some alarm bell to go off. But is that a really cause of worry? Should we take precautions? What can we do about it? To answer all these questions and more, we have two experts with us, Dr. G.C. Khilnani and Dr. Anurag Agarwal. Dr. Khilnani is the director of PSRI Hospital. He's previously been with the All India Institute of Medical Sciences. Dr. Agarwal is with Ashoka University and he's previously been with the CSIR Institute of Biology and Integrative Genomics. Thank you so much, Dr. Khilnani and Dr. Agarwal, for being with us today. First question is a very basic question that I would like to put across to Dr. Khilnani. If somebody has a cold and cough, or without fever, do you suggest that person should take a COVID test in the current
Yeah,
scenario? Will it help
yeah,
in any way?
that's a good question and very practical question, and that's a problem also because so many people have sore throat, cough, running nose, a little bit of headache,
Yes.
and currently, although the published cases, documented cases are not too many in terms of numbers, but
Mm-hmm.
what I'm saying in my practice is the large numbers, large proportion of are coming out to be COVID positive. Now, they are all mild cases. They are not cases with pneumonia or ARDS or requiring hospital admission or ICU care. But once they are diagnosed COVID, they have a trivial illness, fever lasting for a day or two, maybe at best 3 days. And then I need to isolate them and they have to take all the precautions. So, answering your question, the answer is yes. The government of India has also asked for it that the proportion of cases should be tested for the purpose of surveillance. But having said that, there's nothing to worry. There's no place for panic, or we have seen you know uh, 15 million extra deaths in 2 years' time in year 2020 to 22. So everybody is worried. Everybody is distressed about once the name COVID comes. But we should understand that it's a trivial corona infection, which is a COVID-19 virus, which is not causing serious illness, and partly we are immune because of the previous infection and mass vaccination we had. So this is a prelude to the discussion, and if there are any more questions, we'll take it forward.
Yeah. Dr. Agarwal, before we go ahead, could you help us understand what is it that is driving the surge in cases that we are seeing in India as well as in some other countries?
Well, ultimately, there's been a global surge, not just in India. And if you look at the surges, they're happening because of two, three things. The first is the virus changes slightly. I mean, ever since Omicron, it's all been what we now call type 2. They've all been Omicrons. But the surface changes a little bit. That makes the binding of current antibodies more difficult. Then, with time, people who have been previously infected or immunized, they start losing their antibodies. And then new pool of people who were either born later or didn't get vaccinated, they keep entering the circulating population. And then with extremes of weather, people move indoors into poorly ventilated areas, and that you can see in all Southeast Asia, India right now. All of us in
Mm-hmm.
a middle of the day will be into closed air conditioned rooms. When you put all these three things together, sometimes in winter, sometimes in summers, surges occur. And you can actually make out many more surges occur than are picked up by simply looking at SARS-CoV-2 in the sewage, which Bangalore does very routinely. And a large number of people get infected, only a few get diagnosed, as Dr. Saab said. For the vast majority, finding out that they have COVID or not didn't seem to clinically matter. In some situations where it matters, you test for it. But these are the reasons for the surges.
Okay. Dr. Khilnani, every time there is a death, there is a lot of panic among people and for wrong or right reasons. And I'm sure you are also fielding a lot of anxious queries from people. So how do you explain now these deaths which are happening in very few cases? I want to stress on that point. The deaths are very few in number, but even so, it's probably slightly more than what we had seen earlier. Who are these people who may be dying due to COVID?
So, Sumi, there are two things. One is death due to COVID and death with COVID. When we say death due to COVID, what we saw during the pandemic was that person getting pneumonia due to a healthy person, apparently healthy person getting pneumonia with and going requiring oxygen, going into the ICU, and despite all the care, he succumbs to the illness. That is because of the COVID, and we saw all the time. We saw so many. What we are seeing now with this Omicron and sublineage viruses, I need not recite the numbers whether JN.1 or J, B1.8.1. There are several of them going around, difficult to remember. These all are viruses which are, we believe, are confined to the upper respiratory tract. They do not cause pneumonia and ARDS. But the people, unfortunately, who have died in Mumbai, two cases, and some cases in Delhi also, they were suffering from chronic severe illnesses. That is what I am terming as they die with COVID and not because of COVID. Why it is important for everybody to understand so that people don't go into panic. Once they are diagnosed COVID by RT-PCR, they go into some kind of frenzy. Naturally so. So it is better that message goes around that in the interest of the society and then people, people around them, they need to relatively isolate themselves and not disseminate infection. But they don't have to worry or they don't have to go into panic. They don't have to go for corticosteroids. They don't have to take antibiotics, which azithromycin or azithromycin, everybody is gulping as if it will cure the virus. And it will actually causing harm that these antibiotics are becoming useless for other people also. So it is important to understand that currently this particular virus which is going around is innocuous. It causes minor illness. Also, Dr. Anurag was expert in this. That R naught factor of Wuhan virus was 2.5, which is the index of contagiousness, and that of the Delta virus was 5, and the Omicron virus, what is circulating around, is more than 8 or more than 6. What does that mean? That means that this virus is very, very contagious. So you are likely to see more and more cases. But with the course of time, this wave will go away. That's what I think. And I hope no dangerous variant of COVID-19 virus comes again. Thank you.
Thank you so much for that information, sir. Dr. Agarwal, as we know, the COVID pandemic is over and COVID SARS-CoV-2 is now endemic. So we'll keep probably seeing these cyclical surges that we are seeing right now. So if you take the evolution or mutational life cycle of this virus, over a period of time. At what stage of evolution would you say the virus is as of now? Going forward, what do we expect? Like these kind of cyclical surges, spikes that we are seeing right now will keep happening over a period of time, and we'll keep worrying whether it will become a big wave.
The choice to worry or not is with us and how the media projects these things. Sometimes I would say media causes the worry as opposed to responds to the worry. But anyway,
But also
that's it.
try to, yeah, dispel the myth which is going
But
around.
but that said, I mean, first of all, I mean, what is an endemic? Generally, we use the word endemic when there's a constant, predictable number of cases occurring through a particular time period. We aren't quite there. I mean, it's not no longer the threatening pandemic it was, but
Mhm.
because these are unpredictable surges that occur from time to time in very large numbers, we can't really call it gone endemic. It does continue to evolve, and our hope is that this entire type 2, which is all Omicrons put together, as Dr. Saab said, is primarily an upper respiratory virus that doesn't cause pneumonias. So we should be fine. But on the other hand, surveillance should not stop because we think we will be fine. Because when type 2 jumps to a new type, we will not go back to type 1. That is certain. Type 1 is stopped circulating. All the SARS-CoV-2 now in circulation is of type 2, some Omicron or the other. Can we get a type 3 that becomes a variant of concern? Of course we can, because it also jumps to animals. It can hypermutate, can jump back to humans again. So we need to be on the watch out from the public health surveillance standpoint for emergence of a new type of variant of concern. But the public does not need to concern itself with this surveillance, right? All these numbers we have, GN.1, NB.1.8.1, these are for our public health surveillance at a genomic epidemiology level. These are actually never meant to be for public consumption. They have no meaning to the public because they're all Omicron type 2, all typically upper respiratory. Most people dying right now are dying with the virus than of the virus, exactly as Dr. Saab said. And I would say this is not going to end anytime soon, this business of surges, etc. And maybe we will reach endemicity at some point in time, but so far not, because we are going to be in these non-threatening surges as opposed to a purely endemic disease with minor ups and downs. We will see big ups and downs, but very few dead. But one thing I will say at the end of it, there is possibly more than what meets the eye in terms of long-term consequences of infection. Clearly, short-term consequences like pneumonia have gone away. Nobody knows. So exactly as Dr. Khilnani said very correctly, if you have vulnerable members in the house, you get significant fever, you test, you get to, so it's positive. Don't treat it like, oh, it doesn't matter if everybody gets infected. Take reasonable precautions not to infect others, just as you would for a flu infection also, right? I mean, so don't treat viral infections as something that you should spread. If you have an infection, do stay at home, do take usual precautions. It's good hygiene practices, and save the community from more infection.
Again, that's very reassuring to hear all that, sir. Dr. Khilnani, again, a very practical question to you. So, can we have we reached a stage as of now where we can say that COVID is same or similar to influenza, just like we don't worry too much about somebody catching a cold, we shouldn't worry about COVID. I'm asking this because many people said, "Oh yes, I wouldn't have been probably as worried if I didn't have COVID." That question still is there in the minds of people. So, would you like to
So
answer that?
this assurance comes from two things. One is a natural history of the viral disease that we are seeing in whatever Singapore or China or now in India also. Other reassurance come from our eminent virologists who are continuously doing genomic mapping of the virus and telling us that yes, indeed, it is a Omicron virus. Now, the Omicron virus, as we saw during the pandemic also, in the later part of the pandemic, it was an innocuous
Mhm.
virus, innocuous infection. So this uh, you asked the question whether it should be considered as good or as bad as a virus infection. So about the flu virus, that influenza is usually it's a simple illness, but it does kill. It does require ICU care also. But as compared to that, this Omicron virus is much more uh, simpler virus as far as the severity of disease is concerned. So again, the thing that we started saying in the beginning, there's no need to worry, there's no need to panic. It is for the medical fraternity to keep a surveillance of this infection, for the epidemiologist and community medicine person to be vigilant. And the threat of the scare of COVID-19 is going to live with us forever.
Yeah, that's true because we have seen really, really bad times.
Yeah, sure.
Probably, we still haven't got out of that those bad memories yet. So, I would like to know from you now, though the government functionaries, the people who are guiding our health policy, have clearly emphasized that at this point there is no need for taking any booster doses. But again, we see many people asking us. I'm sure people are asking the professionals like you much more. also about whether there is a need for a booster vaccine. But the problem is, in India, we don't really have a vaccine specific to the strains which are in circulation. So how do you see that situation? And do you also, this question probably both of you can take one by one, on whether there is a need for booster doses for anybody, including people who may be having some underlying diseases, the elderly, cancer patients. Does anybody need booster vaccine as of now?
So,
Dr.
Sir can
Anurag?
have the last word. I can go first. So, as you said, the vaccines that can be used as boosters for circulating lineages aren't there in India. And one of the problems is that, by the time you make a vaccine to circulating lineages, the lineage changes. The
Right.
only technology that is fast enough to do this is mRNA technology. And we don't have the technology because it's not practical and because it's not required. So, both things, right? A, it's not a practical technology
I
for
think
India.
we do have a Genovac, the vaccine which Genova has
Right.
made.
It
Yeah.
does, but again, it's not, it's an amplification base. It's a little
Right.
trickier.
Okay.
So we cannot change it as fast, and there
Okay.
is no demand, right, for a
Mhm.
public vaccination strategy.
So, from
So there
production
are
point of
very
view,
few,
it's not lucrative for companies to produce the vaccine as of now.
and the technology that India has frequently killed virus vaccines, protein subunit vaccines, they take a little longer to cycle around with these lineages. Now, is there room for at least one Omicron lineage vaccine in general? Possibly, yes. Should we try treating with a booster from an old version? No, we should not. It's been shown to be useless. The only subset of people who might need a booster would be the severely immunocompromised cancer patients, very elderly. And I suppose, when required, if required, the government always has the option of importing or asking Genova to build a local version and
Right.
or a generic large Omicron version. And I think, but there is no emergent public health need for us to do that. Because as far as we have seen, preventing infections is very hard and severe disease is very uncommon. So, as of now, from a public health standpoint, there is no need for the government to invest in that as a massive thing. But yes, individuals can take their own decisions, particularly those traveling abroad, particularly those, at very, very high risk. But over to Sir for his final words.
Yeah, yeah. Please, sir, go ahead, Dr. Khilnani.
No, no, the final word, there's nobody better than Dr. Anurag Agarwal in understanding the genomics and basics. We are we are only carpenters, treating patients. So I agree with each word, and people may think, people going abroad may think that mRNA vaccine is much better than our Indian Covaxin vaccine. But in this particular situation, unless that mRNA vaccine is tailored for this particular virus, it's not going to be of any use. And I personally feel that uh, this infection which is spreading, I think much more than what we are actually diagnosing. This will impart immunity to us. So there's nothing to worry. I don't subscribe that any kind of vaccination is required, and it's a very big undertaking to do mass vaccination. It's not cost effective. Neither it will benefit us in any way.
Yeah, very important points. Before we wrap up this conversation, so quick points, quick suggestions that you may have for the members of the public who may be watching this on taking precautions on how to avoid getting infected and keeping themselves and the family members safe. Dr. Khilnani, would you like to start on this?
Yeah, but I would say there are two things important. Those, and I'm talking from the experience also, which we had from Kumbh Mela also. We saw so many infections. So those who are susceptible, elderly, 80 years plus or 75 plus, those who are on steroids, those who are on chemotherapy, those who are with rheumatological diseases, on immunosuppressing drug and uncontrolled diabetics, I am advising them not to go to crowded places. Don't go to the places where thousand gathering of 100 or 200 or 500 is there. Avoid traveling by aircraft. Those are the worst places for communication. These are the people who should be extremely in if they get an infection. But now there's another catch. If somebody is immunosuppressed, what the other family members do, if they go out and they get infected, they bring home infection. So it is important for those healthy family members to be careful. Should they have any symptoms, they should isolate themselves, wear a mask at home. As to the extent possible, they should protect those susceptible people. That's about it. Otherwise, life should go on. Life should go on normally. That's what the way I think.
I would
Thank you.
just agree with that. And basically, if you ever notice, if you go to Southeast Asia, many of those people routinely wear masks in crowded places. It comes out of a habit from SARS-CoV-1 that they started. And in general, protecting yourself through masks, etc., in crowded places is not a bad habit. Similarly, hand hygiene, things like this, being careful that when you are infected, you stay alone, don't infect others. That's all, nothing else.
Thank you so much. That's really
All
helpful. Very. Thank you so much for this insightful conversation. Really appreciate that both of you could take out time for this. Thank you, Dr. Khilnani and Dr.
right.
Agarwal.
Okay, okay, Dr.
Thank
Anurag.
you. Bye bye.